So to start off, tell me a little bit about yourself and why you are interested in being interviewed, about your experience, as well as the COVID-19 pandemic.
Well, I am a retired former administrator in higher education. I have had a house in Vermont for many, many years. Became a sort of full-time resident about 10 years ago. I still maintain a house in an apartment in New York. So if you wanted me to talk about some of the New York experiences, I could later, but I've just come back. Um, I have grown children, 5 grandchildren. They're all living elsewhere. The reason I wanted to do this actually is I'm very interested in helping students do their work and get their projects done. And this sounded great, and I wanted to give you guys support.
Well, thank you very much, for offering to do this interview, and I'm looking forward to hearing what you have to say about some of the questions today. So how has the COVID-19 pandemic affected you in your daily routine?
Well, in some ways, since I'm retired, it hasn't had a huge effect. I think the qualities, well, I should say that I do some volunteer work, and I am on 2 volunteer boards of nonprofit organizations, and shifting to Zoom meetings was a little bit difficult, but not really. But it does mean that you're not seeing people so much. But what I really think is that what it took out of my life was 2 things that are really important to me: spontaneity. You can't just go do something. It has to be, as we were saying before, navigated. You have to figure out, is this place going to be crowded? Do I have my mask? Everything has to be plotted out. And so one of the first things I noticed last spring was that I would be sitting here on a day like today, kind of gray, and I'd be kind of, I'd say, oh, well, I'll go to the movies, right?
Mm-hmm.
Not possible.
Not possible.
And I haven't, there's a stubborn part of me that won't accept some of this. So don't like streaming. It's sort of like, there are days when I think, if I can't have it the way I used to have it, I don't want it at all. Mm-hmm. So there's that spontaneity. For instance, I was thinking, oh, today I could make a whole bunch of corn chowder. Well, I can't just, because I'm in quarantine now because I've just come back from New York. I can't go to the store to get the 3 things that I'm missing to do that.
Yeah.
The other thing I think is not being able to do things that are new in the world. Travel, seeing new things, having new experiences. And I think that's tough. And I realized that when in the summer, I guess, or early fall, I made a couple of quick trips down to the Berkshires to go to a couple of museums down there. And when I came back, I took back roads, and I thought, oh my God, this is what I've been missing, being places I've never been before. Anyway, so those, the day-to-day kind of things I can adjust to, but these bigger things about more really quality of life things have been hard.
I think you bring up a really good point, because we don't have, because of restrictions on travel and gathering size, and there's not as much of that freedom to sort of go out and explore as we had pre-pandemic.
Right.
I think that it's certainly difficult in terms of being sort of confined to your state or maybe your area, where you've been for a while, and it's you want to go drive and go explore those back roads, and certainly it's a lot more difficult now than it used to be.
Right.
So how has the COVID-19 pandemic affected your family?
Well, for my immediate family, the biggest change has been the closing of the Canadian border. My son and his wife live in Toronto, and they had been with me for New Year's, but ordinarily I would go there in the spring, they would come here in the summer, I would go in the fall. They have a new house that I've never seen. That sense of a real barrier,
Yeah.
an international barrier, is very, that sense of being cut off from him is very strong. He did manage to come in the summer for a little while.
Okay.
Because he's an American citizen, so he could come in. He's a permanent resident of Canada, so he could go back. But I can't go.
Yeah.
Yeah, which I ordinarily would have done. So that's solid. And we often, a lot in the slightly larger nuclear family, with my stepchildren and grandchildren, we've done huge, I mean, we've usually been together over the summer for long weekends, 4th of July, upcoming holidays, not being able to do that.
Yeah, I think, yeah.
But we've all been healthy.
That's good.
So, I mean, these are the problems of privilege, but they do strike home.
Yeah. I can understand that, and sort of, you know, the difficulty of not being able to visit with family and gather with family as well. I too go to Canada, although I don't have family in Canada. We have a place, our family, specifically my grandfather has a place in Ontario, Northern Ontario, and we go up there during the summers. And not having sort of that access to that place to sort of get away from everything was difficult as well this summer. You know, and you know, obviously, you know, I'm not surprised the border didn't open, given, you know, the number of cases we had in the U.S.
Oh, no, you can't. Yeah, yeah.
But hopefully in the coming months, and you know, with maybe a vaccine on the way, that we can that they'll open the border and we can.
That's right. That would be great.
And we can get up. So you talked about how you've spent time living in New York, as well as up here in Vermont for the past 10 years. And I'm curious to see what you see as the biggest advantage of living in a place like Addison County during a global pandemic, as opposed to maybe living in a more populated area.
Oh, because, well, I mean, particular to, before getting particularly to Addison County, I mean, the advantage of Vermont is strong leadership directed by science and proven. Dr. Levine is right up there on my list with Dr. Fauci, and anyway, that's just been fantastic. I mean, the clarity, the openness, and I think the real advantage is that it's been so under control. I think it's because the population is smaller. If you think about going to a grocery store and you think about what's crowded, I mean, the co-op is never crowded in New York terms, right?
Yeah. Mm-hmm.
So it's, I think, in that way a little bit easier to navigate.
Yeah, no, I think that's, you know, I think I've seen the same things and feel, you know, that having more space and sort of, you know, being able to move around and not, you know, feel like, you know, there's no place you can go where you can, you know, where you're running into other people.
Right. Well, yeah, what saved me and some of my friends is our walking groups, and to have that space. I mean, being in New York right now, nobody has that space.
Yeah.
And their housing is smaller and more contained. Anyway, So that I think the sense of space, the sense of safety. I mean, in many ways, I feel safe here
Mm-hmm.
because of what the leadership and the community, how the communities have responded.
Yeah. And sort of in contrast, do you see any disadvantage of living?
Well, you know, it's the same. It's the same thing as the advantage. It's the isolation.
Mm-hmm.
I just spent a month in New York, and I went to museums. I mean, there's the options are
Mm-hmm.
the options and the perils are multiplied when you get in a space like that. But yeah, but mostly that feeling of being safe.
Yeah.
Is great.
So I sort of want to shift gears this year and sort of move into sort of a question regarding education. You said you've been involved in education, and I'm curious to see what you have to say regarding the decision to reopen schools and colleges this fall, and sort of your opinion on the reopening process and bringing students back into classrooms.
And you asked both about local schools and colleges, right?
Local schools and colleges here in Vermont.
Well, first of all, I am extraordinarily admiring of the institutions, public and private, that have tackled this. As a former administrator, I cannot even imagine. I have had sort of very different feelings about the difference between pre-K through high school and colleges. I've always been very much in favor of opening the elementary schools. I think high school students are a little bit, they're harder to wrangle and better able to do remote learning and be on their own, be on their home alone. But I think I just don't the stress there must be on families and teachers and administrators to keep this going and to be flexible. It just must be extraordinary. So I was very very pro opening the local schools.
And I think,
colleges, I had a different feeling, but
I think it was at least, during the spring when everybody was switching to that remote learning, I could feel some of my professors who had young kids and big families really, stressed out about trying to not only
absolutely
their class, but as well as take care of and teach their own children.
Right. Yeah.
And that couldn't imagine.
Incredible stress on families and schools, and I'd be the first to admit that I'm sure that this form of education, up in Lincoln, where I'm a mentor for a second grader, they're having classes outside still.
Yeah.
There probably have been compromises in the quality of education in many situations where there isn't connectability, all that stuff. But I still think it's more important that they be there than.
Yeah, and I'm like, you think about what you get when you're in person, hands-on, especially in the elementary school age where, you're sort of still developing,
Well, just hand skills. You need to be skills, help you figure out how to maneuver something, give you some hands-on. Yeah, it's tough.
Yeah.
But the colleges, I have to say, I was really, really concerned.
Yeah.
Talking about wrangling, I think you guys are at an age where wrangling is really tough.
Mm-hmm.
I'm now, well, yeah, I don't know what I would feel about a large university. I think my sense is that Middlebury has handled it very well, been very respectful of the community.
Mm-hmm.
What I really most worry about is students coming back and forth.
Yeah.
You guys are about to go like this.
Yep.
And luckily for the rest of the world, you're coming from a safe place, but you're coming back from not safe places.
Yeah.
And that back and forth. And I realize that everybody's done a good job of trying to decrease the number of times that happens, but that's a tough one for me.
Yeah. And I think especially, everybody was sort of holding their breath, at least this fall, in the first couple weeks, because that's when, you bring everybody back. And, I think, it was very clear the restrictions and the guidelines that everybody was supposed to follow. And a few students were removed from campus for not following those guidelines. And I think, it was important to have that system in place.
Yes.
As a reminder to, you've come, you want to be here, you want to be on campus, you can't, hang out with a bunch of people. You need to make sure that you're keeping not only, your, personal health in check, but also, looking out for the community.
Right. Yeah. Yeah. I've been impressed. So basically, that example won me over, at least in this setting.
Yeah.
I haven't seen it operated. Although in New York, I live my apartment is in the Columbia neighborhood.
Okay.
Every kid is wearing a mask.
Yeah.
It's phenomenal.
Yeah.
Wonderful.
Great. So moving on, and we've talked a little bit earlier about sort of social interaction and sort of, going out into the community and how we're interacting with others. And I'm curious to hear your opinion on how that is going to be permanently altered by the pandemic and what changes you're going to see in social interaction.
I think that of all the questions that you sent to me, that was the one that was toughest. I really don't have an answer. I really don't have a sense of that. I think I think there are things I would like to hope would happen, but I'm not convinced I hope that we could carry on this sense of patience with everybody.
Mm-hmm.
The sense of community that's been developed, but I don't know.
No, I think it is a really difficult question, especially when you think about how things change daily in terms of, how, like, in terms of cases or just what people are able to do, what's safe to do, what's not safe to do.
Right.
And I think it's sort of difficult to today say, how are things going to look in a week or 2 weeks? I think people are, living more in the moment now than maybe people have, previously.
Yeah. But I hope that we don't forever stop hugging one another.
Yes.
But I think that sense of patience and tolerance is, I've really tried to come to grips with the fact that people have different levels of tolerance than I do, and to be respectful of that, and with the bottom line that people can't put other people at danger. Yeah. But I'm thinking about, I've gone to some people's before this surge. Went to where somebody had actually taken a yardstick and measured out the distance between people's sitting places. Not something I would have done, but I get it. I get why people. But I don't know. I don't know whether. I don't think people are going to continue to take out yardsticks.
Sorry.
But I don't know.
I think the word patience is really good as well. In terms of thinking, again, people have different comfort levels, as you said, with regarding the virus and how, you've got to be respectful of the comfort that people have, and whether they want to have you to their house during an appropriate time, obviously, or maybe going to get a meal, or just going for a walk outside. Yeah. Someone might opt to wear a mask in that situation, for example.
Right, exactly. But the patience doesn't extend to people who don't wear masks in grocery stores.
Yeah. Which even in our little state of I would say, people who follow the restrictions and who are good about wearing masks, you of course are going to have people who don't, and then, obviously that's their opinion, but unfortunately it affects the rest of the community in that respect.
Right.
So moving on, if you could make one change in response to the COVID-19 pandemic, be it a local response or a national response, what would that change be and why?
Well, this gets to the fact that I think that it's almost impossible to talk about COVID without talking about the context in the rest of the country. So,
Yeah.
The biggest thing was if COVID had never been politicized.
Mm-hmm.
I think that would have transformed everything. This did not have to happen this way.
Yeah.
It is really my bottom line belief. And I would change more than anything else, because I think we could have had it under control. We could have saved lives. We could have been paying attention to the things that were important.
Mm-hmm.
But the context, if you think about it, it's not just a pandemic, it's a political crisis, it's a social crisis, the Black Lives Matter movements and the deaths. It's amazing what we've all been asked to try and cope with. And I think that politicizing COVID just made everything worse, everything about everything worse.
Yeah.
To have armed people on the steps of the Michigan State House objecting to public health measures is crazy.
Mm-hmm.
So that's what I would change.
I think that's a great answer, and I think it's unfortunate that the virus has been politicized so much, and you look at other countries where there's absolutely no politicization about you look at Australia or New Zealand where
Right.
They practically have no cases and they're almost returning to a normal life, and yet you politicize the virus, and then on top of a lot of the other social sort of struggles we have in our country, it sort of amplifies to the point where we have, thousands of people dying each day, millions of cases, and not really any control of the virus and sort of getting a handle.
I think the other thing is that maybe there was no way it could not have been politicized, but you think of it as in a crazy kind of way, because it became politicized. It was a missed opportunity, right? If everybody could have recognized that across every single line that we ordinarily draw, this is an unbelievable threat, and could have coalesced around that.
Yeah.
It might have helped all those other chasms, but it didn't.
Yeah, I think that's a good point, that if we maybe had a better handle on the virus initially, maybe the outcomes of some of the other social problems that we've had or that have been going on maybe would have been better approached, or there would have been a better approach to tackling those issues.
Because we all have grandparents we're trying to protect, right? We all have livelihoods we're trying to protect. We all have communities we're trying to protect. But we can't meet on those grounds.
No.
Because of the other things. And maybe Scott's done a pretty good job of doing that. Maybe if the COVID leadership had been different, we could have crossed some of those other boundaries by saying we all have grandmothers, we all have, anyway, that would be what I would change more than anything else.
Okay. So switching gears now a little bit, we talked about earlier how it's sort of been difficult to explore and sort of
Right.
travel and get out and do new things. But I'm wondering if you've been able to find a new activity, or if you've engaged in a new activity that you didn't before, and that have you sort of come about or come across having sort of more time during the virus.
Well, despite what I said earlier, I am getting used to Zooming. I'm getting used to streaming, and I'm beginning to access some cultural things that I ordinarily miss by streaming. But essentially, I mean, I've brought out jigsaw puzzles that I haven't done in, that I've, the only thing, and this is, I've never joined a gym, but I've started an exercise class. Basically nothing significant.
I know a lot of people started to bake. That was sort of
I know.
once, you could go to the store and there'd be no flour left. It'd be like,
right, exactly. Well, that desire to feed yourself. But my problem is, if I baked, I would eat it.
Yeah, I think, especially with having like more time at home, and
yeah,
you bake, and then I think people started even selling some of what they started to bake, and these like little mini bakeries started popping up. And one way
that wonderful woman in Bristol who bakes all the time and leaves it on her porch for other people.
Oh, that's very nice. Wow.
Yeah.
That's another way of supporting the community.
Exactly. Yeah.
So in terms of the vaccine, certainly, I think that's something that's been on a lot of people's mind, especially with a lot of these big pharmaceutical companies coming out with their vaccines and going through the FDA process, and hopefully the coming weeks becoming available potentially. So do you plan on getting the COVID-19 vaccine when it becomes available? And what, if any, concerns do you have about the vaccine?
Well, my very flip answer is that if Dr. Fauci takes it, I'll take it. And I think this idea that just came up, that the three former presidents would all get their vaccines in a public setting that could be, is a fantastic message. At the same time, there's a part of me that worries about having this process be rushed. I'd like to be more confident that all the protocols have not been stretched or tweaked. Yeah. How can you not think that Pfizer isn't in it for the money? There's all that pre-pandemic distrust of big pharma.
Yeah.
I don't know.
I think it's very fair that, to have that perspective, because, of course, when you do boil, there is the vaccine, it is a safety thing, but there is a lot of money involved. And, we put our trust in these companies, we put our trust in the FDA to, scrutinize every vaccine to make sure that it's, that it is safe. And, I think that there will be more resistance, my guess, to this vaccine than others in the past.
Oh, well, it's going to be politicized the same way masks have been. I mean, it's going to fall in the same. I think we're going to have better leadership and better messaging around it, but I think it's still going to be politicized. But it's interesting because I was too young, but as a child, I remember the polio vaccines, getting the polio vaccines, and they were done at school. They were both, but I can't remember what, you've probably studied the history of this, but wasn't the shot first and then the sugar cubes were second? Salk and Sabine, I can't say, whatever his name was, there were two S's. And we got both versions of it distributed through school. I think you had to have 2 sugar cubes. I mean, different. Yeah, and I think the question of who gets it first is also going to be politicized.
Hmm.
I think teachers should be right up there right away.
Yep.
So I wish that I didn't have any qualms about it.
Hmm.
And I'm just going to, after you say, I'm just going to have to go on faith. And if Dr. Fauci, unless he's on the side raking in lots of money from Pfizer,
Yeah,
uh, I'm going to go with him.
I think that's a safe bet. He's certainly been a critical figure and an important voice to this entire, during this entire pandemic, especially in the face of sort of the opposition of and
Oh
sort
my gosh.
of, without Fauci.
I should have brought out. I have a Dr. Fauci bobblehead.
That's awesome.
Yeah, um, yeah. This goes back to the bigger picture. The
Mhm.
distrust of science and reason and language. It's frightening to me, and I don't know how we repair that. But in some ways, this if we could get a handle on it, this would be a good time to do it,
Mhm.
to restore people's faith in research and. But so I'll take it. Rugby has, in a relatively recent past, like 4 years maybe, um, added to its mission advocacy. The Robinson family that lived at Rugby, um, the, the, of the 4 generations, one of them were very, very radical abolitionists. So we've decided that in that spirit, we were going to add some advocacy to around racial justice, social justice. That we had to close down.
Yeah.
We have some plans. We had to. We also have a new director. Some of our plans have to be put on hold for things we were actually going to do. What the one thing that we did do is we have a doctor on our board who wrote an essay that we distributed about how the pandemic is disproportionately affecting people of color, and that was distributed to our community, to the museum community. But I think it was also picked up by V.T. Dicker.
Okay.
And I don't think it was. It was a really, really wonderful little essay.
No, I
So,
think that's, yeah. Like I remember learning about Rokeby when I was
oh,
thinking either middle school or high school, possibly even elementary school. I never visited or have not visited. I've been wanting to. Um, Obviously not during a pandemic or when it's
in the spring. If in the spring, we ended up opening in August.
okay. So
Yeah.
okay, awesome.
So where did you grow up? Here?
I grew up here. I'm from Middlebury.
Oh, okay.
Yeah. Yeah.
Yeah.
I guess it would be sort of a little peculiar to grow up out of maybe Vermont or New England and have learned about the museum, but I'm like, no, I can't remember how old I was, but certainly learning about when we were learning about sort of the abolitionist movement.
And the Underground Railroad.
Yeah.
It was a stop. Yeah.
That's where we learned about it.
So what we're trying to do is connect that past with current and see how things are mirrored or progressing or not progressing. And
I think especially given the state of which our country is in terms of, you know, um, sort of there's still a lot of problems that we have with race and sort of, these issues that have I think never been solved. And I think it's
absolutely right.
it's great that Rokeby is sort of connecting, in this, especially with COVID-19, sort of connecting sort of the past and the present to sort of bring light and bring light to an issue that needs to be solved and needs to happen.
Yeah. Well, it was interesting because, one of the things to say is that obviously the history extends and the current issues, as they remain, extend in ways that people don't usually think about, as in medical availability, or the fact that the essential workers in most of the situations are people of color. But it was interesting. The first time I got a COVID test was in June, because I'd been to one of the Black Lives Matter rally protests in Montpelier. Mm-hmm. And Dr. Levine got on and he said, if you went to one of those, but it was interesting to navigate that. I mean, I was constantly saying, am I standing far enough away?
Sure.
Anyway.
Yeah. I mean, at that time in Vermont, it was, I don't think we had really gotten to, there was, masks, I think masks were recommended, and physical distancing. And I think that even at that point where we weren't seeing, 100 new cases a day, there's still that awareness that's sort of in the back of your mind, the sort of the risk and sort of, am I limiting my risk? I'm like, that's, I think you bring up a really good point, because people wanted to go to those protests and wanted to make themselves heard.
Right.
But there's also that sort of internally, am I safe? In terms of COVID-19, am I protecting myself?
Right. And you think of that was a Montpelier protest. I mean, think of the people who actually went out on the streets in Portland and Minneapolis and Nashville. One of the things I have to say about this last 9 months is that I am feeling very much that this world belongs to you all now. And I am so heartened by the activity and the thoughtfulness. Some of those particularly not to, I'm very much admiring of you as well, but young Black women who have spearheaded so many of these things, the Montpelier Black Lives Movement, and the women the young women in Nashville, who I think I've got the Southern City right. Breonna Taylor.
Yeah.
Oh, no.
No.
Louisville.
No. Louisville, yeah.
Louisville, sorry. Anyway, that's another sort of thing that's happened, and I'm not sure how much it's COVID in it is, but I feel as if this is not the world does not belong to me anymore, and that's okay. It's okay as it should be, and I'm hardened by what I see.
Certainly, growing up at this time, or at least living in this time, and sort of live, it's a lot to take in and it's a lot to process. Yeah. But there is light at the end of the tunnel. I hope, and just take, as I sort of, my mentality has been sort of taking one day at a time, and sort of just again navigating.
Right.
Yeah.
It'll be what I really wonder about my grandchildren is what they'll remember about this. Particularly the ones on the younger side. What is anyway.
Well, I think that's all the questions I have. Yeah. But thank you very much for taking time.
You're most welcome. Thank you for including me.
And I hope that in the next few weeks and into the new year that you're well, and that hopefully you'll be able to get back to sort of going out and exploring and sort of getting back to the spontaneity of life once COVID-19 is under control. And we can
Thanks.
sort of return to a more normal life.